Well, Dr. CJ Stec of Stec Family Dentistry here to talk about some teeth whitening. And good evening, Doc.
Good evening. How are you?
Wonderful, yes.
Okay, let's start with the root of the problem here. What causes teeth to turn yellow? Don't tell me pop.
Well, that's one of them. There's a lot of things that do cause your teeth to stain, and it ranges from pop, coffee, tea, obviously smoking and that kind of stuff will stain your teeth. There are some genetic factors to it. Some people are just born with darker teeth. And then there's some pharmaceuticals like tetracycline. It's an antibiotic that we used to be given a lot, and that used to cause a lot of staining on teeth. So,
Doc, there's a lot of options out there. Which ones, I mean, there's the trays, the tape, what have you. What do you offer, and what do you think are the best options?
right, there's a lot of stuff out there on the market these days. Everything from the mouth rinses to the whitening toothpaste. What we typically offer and talk about with people are either the take-home bleaching trays where we fabricate in the office and then send you home with some gel, and use those over a couple weeks, and that can get you your whiter teeth. Or you can do a faster route, which you come into the office for a couple hours and you can have a Zoom whitening procedure done where that takes a couple hours and you can leave with a whiter smile that day.
Do these whitening products actually just like remove or dissolve the stains? I would guess kind of like bleach with your laundry.
Well, there's a couple different ways. It's mostly stain removal. So on the surface stain on teeth, a lot of it is just getting it taken off. So the toothpaste and that kind of stuff, they don't do a whole lot of actually deep down whitening, but what they do a pretty good job of is by taking off that surface stain. Kind of like when you go to the dentist to get your teeth cleaned. They always look a little bit whiter afterwards. It's because we're scraping or getting that stain off of the teeth. Now the deeper stain, the stuff that is underneath the enamel or that outer layer of the tooth, that needs to be taken off with kind of usually a chemical process, which if used properly, what it essentially does is it will break some bonds, some carbon bonds in that stain itself, and allow light to reflect off of it differently, so it no longer reflects yellow, it reflects white like your natural teeth look like. So,
Dr. Stec, what is this Zoom treatment that you speak of?
So Zoom whitening is a process that's kind of developed by Philips. It's a process. You come into the office, you'll sit down and we'll make you some custom trays to take home for kind of touch-up trays after the Zoom process. And we'll paint some stuff on your teeth, some of that chemical process that we talk about, and we shine a light on your teeth, and it takes a couple hours, but you can leave that day with a pretty white smile. So we've had very good results with it. And we just got the new version of it. So some people have had sensitivity with in-office whitening before. Now with the new technology that we just got in our office, we're able to adjust that to make it more comfortable experience for you.
And real quick, is it safe for everyone, teeth whitening? Is it okay?
Generally it is. You know, as long as you follow the guidelines and you consult with your dental professional before you have any procedures or you start doing any whitening, it's good to always have that consult first just to make sure that there aren't any contraindications for yourself, so it is a good, safe procedure. Almost all the time, nobody ever has a problem with it. You know, there might be a little sensitivity, but again, like I said, with the new technology, we're able to help make that process a little bit more comfortable for you.
All right, Dr. CJ Stec of Stec Family Dentistry in Grand Island. Thanks for joining us live. We'll see you soon.
All right, thank you very much.
And we'll be right back.